It's never exhausted. And you cannot stop it. Nah, you cannot stop it.
Good afternoon, Haiti Oropesa with Stephanie Pointer. We're waiting for this afternoon's guest, Hillsborough County Commissioner Harry Cohen. He'll be on shortly. I'm going to be sharing this with Florida Youth Judge.
I will not jump in these boxes they throw at me. Talking to God and there's so much He's showing me, shaping me, growing me, taking me sowing seeds, a growing tree. Y'all get a load of me, yeah. Don't let them slow me. I get the bag like a grocery. I'm on my grind like I'm supposed to be. And I do not care.
Hi, Commissioner. So,
I cannot fit in the boxes. Stop it. Stop it. Quitting was never an option. Exhausted. This passion is never exhausted. And you cannot stop it.
something happened. Connection.
Hands in the sky, if you got a dream. Sure, nothing was blocking me. I was the problem, the only one stopping me. I didn't like it, I had to refocus. Now I'm devoted, I know where I'm going. Controlling emotions, I'm owning the moment. In order to get it, see, you gotta want it. This type of flow make a living break. Confessions over these 808s. Don't sleep on the key, better stay away. I'm here for heaven's sake. I'ma be the best. Came from the endless. Playing with the games, bitch with the chest. He beating on my chest, trying to get my rest. Watch me while I flex. Every win is a blessing, and every L is a lesson. So when I run into rejection, I know it's all in redirection. I see the blessings right beside me. The chances of quitting are likely. I do it like I'm in my Nikes. Don't make excuses, they never excite me. Boxes. I cannot fit in the boxes. Stop it. Quitting was never an option. Exhausted. This passion is never exhausted. And you cannot stop it. Nah, you cannot stop it. Quitting was never.
Okay. Good afternoon, Commissioner.
Good afternoon.
Hey, good afternoon.
What?
Can you see me okay and hear me?
Yes.
Perfect. Okay, well, we're glad that you're joining us. We know this last week we read headlines, at least I did, while relaxing after work and watching what's going on in the world and locally. And I saw a headline, many people, I'm sure, regarding a vote that the Hillsborough County Commission had on an issue of eliminating fluoride from the water system. And you're here today to talk to us, inform us, the community about that.
Mm-hmm.
And welcome.
Thank you. Thank you for having me. I'm glad to be with you.
So, Stephanie,
Thank
do you
you.
want to lead the discussion?
Yeah, thank you for speaking up for our kids and our community. I'm done a little bit of basic research on this, and I just, what befuddled me was at the end of the meeting that Commissioner Wastel could have asked for a workshop to discuss this further, but he didn't. He just wanted to go immediately jump off the bridge. And that's what I was telling Haiti earlier today. This was, let's go jump off a bridge. We have research that shows we should jump off bridges. And what you were saying was, don't you think we should do a little bit of investigating before we jump off a bridge? Because this might not be the best thing. And you're basing this on one study and one court case, whereas we have 100 years of research that has showed to the contrary, and the amount we're putting into the amount of fluoride we're actually putting into the water versus what's automatically in there is just minuscule. So you want to talk to us a little bit more about that? Well, I do appreciate you taking it for us.
You really said it very well. You don't really need me because you really laid it right out. The bottom line is that for 100 years, the American pediatric, I want to make sure I get this right. The Academy of Pediatric Dentistry said that fluoridation of the water supply was one of the 10 greatest public health initiatives of the 20th century because it reduced the amount of cavities and dental problems in children and adults, threefold. And before we go about making changes in something that has so demonstrably worked, we ought to be very sure of the science that we're looking at. And as you said, there was a court case in Northern California where a study was cited that was conducted mainly out of the United States and mainly in places where the fluoride amount in the water was much larger than the amount that local governments and the federal government recommend in the United States. And while that court case made some conclusions based on that study, the conclusions weren't based on the levels of fluoride that we see in our water across the United States. And so there really isn't any evidence out there to support these claims that are leading to people saying that we should take fluoride out of the water. What I said in the meeting was, let's get experts on both sides of the issue, pro and con, to come into a workshop, give them equal time, and then we can weigh the evidence. Let's not just, go off and do something before we've done our homework.
I agree.
Smart.
I totally agree.
And
spend some time doing some homework.
Oh, and let me say something else about fluoride in general. It is true that people can get fluoride from other sources. And it is true that someone who goes to the dentist regularly and eats a balanced diet can accomplish getting the necessary amount of fluoride through their diet. But there are many, many people in the United States that don't have adequate dental care and don't eat a diet that exposes them to the optimum amount of fluoride. And by putting it in the water, we're able to make sure that everybody gets it. And they get it when they're particularly when they're children, when their teeth need it the most to develop it strong. And there is incontrovertible evidence that fluoride in modest amounts help strengthen the tooth enamel, and overall dental health is an absolute corollary to all general health in people.
And I was just going to add that the only one of the few articles that I was able to read to prepare for discussing this is the very case that Commissioner Wastel, who called this a diabolical thing to vote against this, the only case that he's basing the urging of the commission to pass the elimination of fluoride in the water is a case where the federal judge who's mandating that the EPA strengthen their regulations, the presentation that was made for the judge to decide whether to do that or not, he said there's a high level of certainty. However, he himself says he's not absolutely certain. So,
and the American Dental Association spoke to that specific case and said that it was not that the information from that case should not lead to a change in water fluoridation policy. They said it as plain as day, and they said it after the case came out.
So it boggles me that a commissioner would take issue or umbrage at another fellow commissioner, yourself, where you just are wanting to take pause before you take a vote. You're basically saying, let's do a workshop. Let's look more into this before we take a vote. I don't see how that's a bad thing, especially when he's pushing this because of a case where the very judge that's relying that there may very well be a high level of certainty is not certain. And to your point, what you just already touched upon, there's going to be the fluoride does help in that aspect as the strengthening of the enamel, the prevention of cavities, whereas in those other sources where they may be able, some segments of the communities could get fluoride. In poor communities, they may not, and they'll probably see an increase of cavities. That presents an issue, and not just to the cavities. If there's issues in the mouth, that could go into the bloodstream.
Absolutely, it is absolutely the case that that dental problems lead to other health problems, particularly if they go untreated. And my hats are off to the dentists. First of all, a number of dentists reached out to me in the short time that this was on our agenda prior to our discussion, and really raised the alarm about how detrimental this could be. But the reason my hat goes out to the dentists is because when in the 1950s and 60s, when the original mandate to put the fluoride in the water was really gearing up in earnest, the dentists understood that if this was successful, it was going to actually negatively impact their business. There were going to be less people needing dental care and dental treatment if we if we took these steps, and they supported doing it. And they supported doing it because of the enormous public health benefits that we've seen. And, I don't think that we should reverse things like that without adequate study.
They said in the Times that Pinellas County actually removed their additional fluoride back in 2011, and they dealt with a whole lot of backlash, and they ended up putting it back in after our local experts, our dentists and whatnot, came forward and said, hello. I'm also, and that may have been connected to that green study from 2010.
Let me tell you what the backlash was. The commissioners that voted to do that lost their seats.
Wow.
That's how upset the community was by this. And I will tell you, I have been, just in the short time since the meeting on Wednesday, I have had people coming up to me, literally stopping me and thanking me for standing up about this, because they're so horrified that we would consider taking an action like this without even having any real study and discussion of it.
I would have to agree. I mean,
that's
what disturbs me the most is that this was produced and proposed. You and I, we all know that I don't follow the BOCC as closely as I do city council, but there is no way that council would consider something of this magnitude without having some research and some study behind it. And it disturbs me that 3 commissioners voted to do this with no basis whatsoever. I mean, that really scares me, that they're willing to make changes based on something that's not that they don't have enough information on. Yeah. Nobody up there, just like you said, you're not. He asked you, "Are you a doctor?" And you said no. And of course, he's not either. And and making decisions like that without experts weighing in on it is absolutely ludicrous.
Stephanie, you're right. I'm not a doctor, but I am a lawyer, and I tell you that I'm not going to rely on one court case from the Northern District of California that's based on a study that's not relevant to our current situation in making a public health decision that could affect literally millions of people. So
I agree. I'm assuming that the case that they talk about is the study done in 2010 by Rivka Green, and it's Johns Hopkins website is very, very forthcoming with information. And one of the things they say is there's not a control for the variables. I mean, we just in the last, 60 days, 90 days, got rid of red dye from our foods, artificial red dye. That supposed IQ drop could be attributed to those kids being exposed to that red dye versus the other. Although it says in the last 100 years, IQ points have went up by like 30 points. So the question is how do you how do you control only for fluoride, with the exception of we need to understand what it does for our teeth and what it does for our kids, and to make a sweeping decision like that is just unconscionable, in my opinion. I'm willing to read more information from credible sources that would make me change my mind about this particular subject. But I'm very, very concerned about the fact that people are ready to make judgments on stuff like this without credible information.
Okay, if I could just jump in, I shared this headline for those who want to maybe go on Google and look for this article. They do embed the actual not the opinion, but they're linking to another media outlet discussing that decision, and therein it says that it's a federal judge in California. But again, this is the article that I read that pretty much says that even the judge is not completely 100% certain that, in fact, fluoride would have the effect that Commissioner Wastall's trying to eliminate fluoride from the water that he's suggesting would do damage to the children.
And
So
let me say one other thing. There's another option here, and that is to perhaps the amount of fluoride should be tweaked in some way. You don't have to go either or. You can also look at whether or not the amount is correct. Right now, our amount is exactly the standard that is recommended by both the federal government and the American Dental Association and the American Academy of Pediatrics. But, had a discussion, the options aren't just stay the same and take it out completely. They so to affect the dose. But again, you have to know something about what you're talking about before you can make decisions like that.
Right.
Exactly. And so, and to take it out completely is just jumping off the bridge.
Yeah.
Sorry. So
thank you. Whoever, I think that's somebody that came on before. Yes.
I think it's Nathan Coper.
Yeah. And he said, RFK Jr. says we should jump off a bridge. I'm sold. He's being sarcastic.
I'm with you there. It's really scary.
Well, thank you. That's the type of common sense and responsibility that every voter, resident, citizen should expect. Just for you to put the brakes on and say, "Wait, I'm not opposed to this, but we did need to sit down and have a conversation."
Let me say, I am opposed to it until somebody can convince me that there's medical evidence out there that warrants making a change.
That's what I was meaning. That's what I was referring to. That at this time, unless somebody can prove you otherwise, you can't just immediately be on board and vote for something that might result in a further harm.
Oh, I think it will. I think that would result in harm.
Right.
Let me just close by saying, this issue is not totally dead. There's a lot of discussion that it's going to be taken up in the legislature this spring. So I would urge people to encourage their representatives not to do this. And the other thing I would say is that, we've got to stay vigilant because a lot of these things get put on the agenda sort of, with not a whole lot of time to prepare. Mm-hmm. And it's very, very important. Stephanie, I know you're out there watching the city council, but there are a lot of other bodies that are out here. And it's very important that citizens pay attention to what's going on. Because I will tell you that when the dentists heard about this, they really mobilized into action very, very fast.
And that's wonderful. I have one question for you, just so we can save our viewers a little bit of homework. Can you tell me who voted with you to not do anything until we have more information?
Yes. Commissioner Hagan and Commissioner Bowles voted with me. Commissioner Meyer was called out of the meeting because of a family medical emergency. I'm 99% certain that she would absolutely have been on the side of me and Commissioner Hagan and Bowles. So I think it would have been a 4-3 vote.
Well, I'm certainly glad that those two voted with you on it to hold off, learn more before you jump off the bridge.
Okay, I have a question.
Yes.
What did Commissioner Wastall, other than that one case out of California, what other information was presented to support his position?
I'm not sure what other information he has to support his position because I'm not aware of what medical backup there is for that position. I haven't seen any. Everybody that came and spoke in favor, I mean, they were all well-meaning, nice people, but they weren't medical doctors and dentists. The people who spoke against were medical doctors and dentists who took time out of their busy schedule because they were so alarmed at what they thought we might do.
All right. And people need to think about the point that you've already made, that these people stand to profit financially if fluoride were to be removed from the system.
Absolutely. Absolutely.
Yep. So they're there as advocates saying, don't do that. That's a bad health call. And then even though we're not going to make as much money, we're still here to say, no, don't do that.
Yeah.
You have anything else, Stephanie?
No. Thank you, Harry, for coming on today. We really do appreciate it. Oh, I'm supposed to call you Commissioner Cohen.
Okay.
Thank you, Commissioner Cohen. Thank you so much. Everyone have a great rest of your Saturday and weekend.
You
You
too.
too.
Bye-bye.
Bye.